Dear parents, I welcome you all to this educational seminar on methicillin-resistant Staphylococcus aureus infections. Last month, a concerned parent brought to our notice that their child developed symptoms of a serious infection commonly known as MRSA. The parent suspected that their child acquired the infection here in the school. We as a school are committed to the safety of our students and take such matters extremely seriously. We immediately contacted our local health department that conducted an investigation into the case. Today, we have our experts here who would like to inform you about MRSA and the outbreak investigation done here at school. I would like to invite our first speaker, Dr. Jeffrey Cow.
Thank you very much, Ms. Sheffia. So the question you're all here to learn about. What exactly is MRSA? Why is it important? Hopefully, by the end of today, you'll be much better informed about MRSA and how this bacteria can impact you and your child. First, I want to break down the name. MRSA. The SA in MRSA stands for Staphylococcus aureus, also known as Staph aureus or just Staph. This bacteria is the #1 most common pathogen found in hospitals and in the community. In fact, approximately 1 out of 5 of the people here in this room harbor the Staph aureus bacteria. And under most circumstances, they're actually part of the natural bacteria that live with us, and they don't pose any threat. Originally, staph infections occurred mostly in hospital settings, following invasive procedures like surgeries or implants. And to treat these infections, the antibiotic methicillin, which is the M in MRSA, was used. Eventually, some staph bacteria developed a resistance to methicillin, which is what we now call methicillin-resistant Staph aureus, or MRSA. In the past few decades, MRSA has become a problem not just in hospitals, but in communities full of healthy people like this one, and that's why we're all here today. Community-associated MRSA, or CA-MRSA, can be spread from person to person by direct contact, and especially when you have broken skin, like from a cut or a scrape. MRSA can be easily transmitted between people that are crowded together or have frequent skin-to-skin contact. It can also be easily transmitted on solid objects and surfaces, such as contaminated towels, benches, desks, or tabletops. So who are we most concerned about when it comes to watching out for MRSA? The answer is athletes. Our student athletes come into contact with each other all the time, especially those participating in contact sports. And these athletes also come into contact with jerseys, towels, and locker room amenities that can easily harbor the MRSA bacteria. And don't forget, these athletes are students as well, which means that they come into contact with many of their peers and mentors throughout each day. And this means that everyone at the school could be at risk for infection if we don't recognize and treat MRSA early. There are a number of other groups of people that studies have shown are at higher risk for becoming infected with CA-MRSA, and those are listed here. But for the sake of relevance to our meeting here today, we won't be discussing these groups at this time. So one of the most important things I want to talk to you all about today is how to actually identify a potential infection with MRSA. The first signs of MRSA are pretty nondescriptive, unfortunately, but they are a good warning sign for you to contact your physician. And these signs include fever, chills, and occasionally low blood pressure. More advanced symptoms commonly include skin infections, such as a boil or an abscess, as you can see in this image. This skin infection is commonly red, swollen, and can be tender or painful. Promptly contact your physician if it begins to ooze fluid. Less frequently, you could see shortness of breath or some other symptoms listed here. The hope is that you'll recognize the signs soon enough so that your doctor can identify the infection before you or your child gets to this stage. In the community, most MRSA infections will involve fever, chills, and the skin infection that we just mentioned. More severe cases, such as those that we see in hospitals, can actually cause life-threatening conditions. These conditions include bloodstream infections, pneumonia, and necrosis or decay of body tissues. Again, I want to stress and emphasize that the key here is to recognize the signs of MRSA early and take action. When you recognize possible signs of a MRSA infection, your doctor will take a few basic measures to test you or your child for infection. A quick nose, mouth, or skin swab is really all it takes to make the initial diagnosis. In fact, no blood draws are necessary in most cases. And if these tests come back positive, then you'll need to be treated appropriately for MRSA. The first step will be to drain the infection site. And after this, there are several alternative antibiotics that may help to alleviate the infection. Now that you're all basically experts on MRSA, I'd like to introduce our next speaker, Mr. Oluwatobi Adegboyega. He is the public health officer with our county's health department and will be leading the investigation here at the school.
Now that we're familiar with what community-acquired MRSA is, we will now look at the steps of investigating this outbreak as recommended by the Center for Disease Prevention and Control. The first thing is to confirm that an outbreak really occurred. By definition, an outbreak is when disease or infections occur in excess of what is expected in a place at a particular time. In this instance, we looked to see if this was a new infection, and due to its tendency to spread from person to person, it was important that we investigated it. Secondly, we confirmed that this was truly what we thought it was. This was done through tests carried out on the infected parts. Next, we made a broad definition of what a typical infection would look like. This is to help in identifying other possible cases which are people with infection that may be linked or not linked to the one we're currently investigating. Next, we describe what we found by classifying the cases based on personal characteristics, place, and time. This step helped us to begin the process of identifying possible sources of the infection. By considering individuals at risk, we can further identify more cases and also advise them on how to prevent the infection. This step is very important in preventing the spread of the infection. Based on what we have found so far about the characteristics of the cases and from questioning and interviewing them, we developed an idea of what led to the outbreak. We then collected more information to disprove or confirm what we were thinking. We did this by comparing the exposures of those who had the infection with those without the infection. Furthermore, we compared what we found with established facts about the type of infection and further examined our facts. By this, we refined what we were thinking was the likely source of the infection and evaluated if we needed more information. Finally, we provided a written report on our findings and suggested ways to control the spread of the infection and prevent another case from occurring. So that wraps up the 10 steps of investigation as suggested by the CDC and how we carried out investigating this particular case. Some of the recommendations we made after the investigation of these infections are the following. Supervisors and coaches should not allow athletes with suspicious skin infection to use common use water facilities until all infections and wounds are healed. They should also refer athletes to a healthcare provider when they suspect an infection. If a diagnosis of MRSA is confirmed, they should stop all students from using the facilities until the area is disinfected. When clean supplies like soap, bandages, hand sanitizers should always be made available. They should also educate athletes about community-acquired MRSA and encourage healthy habits. They should also encourage athletes to report all infections and keep wounds covered at all times.
Thank you, Dr. Kao and Mr. Adegboyega, for the informative session. Dear parents, I hope you found this seminar helpful. We are seeking your support to encourage students maintain adequate hygiene so that they can protect themselves. If your child develops any suspicious skin lesions, please seek medical attention immediately and also notify the school authorities so that we can protect other students as well. I thank you all for your participation.